Hi, I'm Darla Watanabe. I'm one of the nurse coordinators for the supportive care program here at Stanford. My colleague Esther, we're the two nurses that you probably have had conversations with on the telephone if you've called in for any of our programs. It gives me a great pleasure to offer this lecture this evening by Dr. Emily Ock. And it's on parenting at a challenging time, help for parents to have that difficult conversation with your children. She's an assistant professor at the Department of Psychiatry and Behavioral Science here at Stanford. She works at Lucille Packard, and she also has a program called Help for Parents with Cancer called PACT that she'll talk a little bit about as well, that's now being offered here at Stanford. So without any further ado, Emily, please, thank you.
Sure. Okay. Hopefully it won't be too much shuffling. So obviously we have a pretty small group, so if at any point you have questions, just interrupt me and we'll just kind of do them along the way. So thank you, Darla, for that introduction. So this is a program, it's called Parenting at a Challenging Time, and we're going to sort of talk about sort of the basis for the program, the rationale behind it, as well as a lot of the kind of principles that we work with parents to develop and to hopefully demystify some of the difficult topics that can come up when, talking to kids across the age span about, your own health or a parent's health. So no conflicts of interest. I just want to acknowledge a couple different contributors. So Paula Rausch is a child psychiatrist in Boston who actually really developed this program, and it's been up and running at Mass General for about the last 20 plus years. So if she's sort of the the brain behind all of this and has done a lot of really interesting work and research on sort of the necessity of programs like this and the impact that sort of not having positive communication with kids can have on their resilience and sort of coping, and also the significant impact an intervention like this can have. And then here at Stanford, Stanford Medicine and the cancer survivorship program have been very instrumental in helping us to kind of bring in the program and implement it sort of in a way that fits with the treatment teams here. Okay, so the program is really based on a parent guidance model. So we don't ever actually meet with the kids themselves. And it's a consultation model. So we sort of view ourselves as the experts on child development because the perspective that the program takes is very much sort of one of development across the lifespan, but the parent is the expert on their child. And so when we come together for the consultation, it's really about sort of learning from the parent how the child is doing and what their specific concerns are relative to, that child or, each of their children. And then helping kind of the parent to develop some skills and some ways of sort of frameworks for thinking about how to have the necessary conversations with their kids, with each child. And it may look very different because the kids' needs are different and they're different ages and they're different temperaments. And but also then how to, sort of recruit other resources in their communities or sort of spheres to support the kids. So one of the things that I see all the time is this idea of, parents who are avoiding talking to the kids about the illness, the diagnosis, the realities of what that's going to look like, in a very well-meaning effort to protect the child, but without an understanding of the repercussions of that withholding of information. And obviously, again, it's going to be different for different ages, and how much we would encourage the child to be told is going to vary too. But I had an example or a family recently where I was talking with the mom on the phone, and the kids were like school age, like elementary school age, and she'd been going through treatment for a while and they hadn't talked to the kids yet. And at the end of, probably a 25-minute conversation, she goes, well, I think one of my kids may know something. And I was like, oh, really? Like, what makes you say that? Well, he found my discharge summary and he asked me if oncology meant cancer. And so clearly the school age kid is putting pieces together. And what's happened at that point is, hard to know how long prior to him asking, he had found that. He was alone sort of with that information, which could be very scary for a while. And that's, one of the things that puts kids at risk is not having that sort of support and really permission to talk about what's going on for them. Okay, any questions? Okay. So we kind of talked about that. So it's really, we're try very, very hard to tailor it to the individual needs of the family and the kids. So while we have a framework which we'll go over, what the actual conversation looks like varies wildly. And I think that's one of sort of the nice things is that, we're sort of designed to take into account the temperament and specifics of the individual family and, what resources they have at their disposal or not, and sort of work within those confines. Okay. Ooh, that's weird looking. Okay, I don't know why it's hazy, but so this, where the star in the center, this is sort of a framework for thinking about how kids sort of function, and they're really embedded in a system, amidst multiple systems. So if we think of the child as the star in the center, that's really the nexus of where the kid sits, and how they cope and function is a product of a myriad of factors. So they're embedded in their family, in their community, how old they are, what's sort of hard for them, what is their sort of strengths and weaknesses. Is it a very outgoing social kid, or is it a more sort of shy and anxious kid? It's where temperament can come in. Siblings, what does that look like? Are there any? How old are they? What's the age difference? And all of that, sits in the community, whether that's the school community, a religious community, sort of social network, soccer, whatever activities they're involved in. All of these things sort of come together to wrap around and sort of create the child's world. And we'll talk about this in more detail a bit later, but thinking about what those various systems are that the child is a part of is really important to thinking about, as a parent's capacity perhaps to provide the support, of a given week or month to the child. Who are the other sort of players in the child's life or sources that can step up and sort of provide for some of the child's needs that in the moment are more difficult, within the family system because it's being tapped in new ways. So why does this matter? Well, clearly it matters to you guys because you have kids and are going through treatment or know someone close to you who is. But more broadly, this affects a lot of kids in the country on any given year. So 3 million kids in the US, so under 18, live with a cancer survivor. So not necessarily someone who's on active treatment, but who at some point most likely during the child's life, has had a period of diagnosis and subsequent treatment. And then 18% of patients at any given time who are undergoing treatment have a dependent child in the home. So this affects a lot of kids and a lot of families. And what we know is that the increased stress among patients who are parents, who have kids under 18 at home, the parenting stress that they report is significant. And with that, greater concerns for recurrence, increased anxiety, depression, lower quality of life, decreased satisfaction in their role as parent. So the diagnosis impacts so many aspects of the individual's functioning, whether that be child or parent, as well subsequently as the interaction, between the two and within the family. So addressing kind of all of these factors is a really important piece of sort of promoting and child and family resilience in the face of a difficult set of circumstances. So we can all agree that the impact overall is significant for everybody in differing ways. Okay. So a few of the kind of tenets, if you will, of this model is that open communication within families is a good thing. Not necessarily an easy thing, but a good and important thing. And oftentimes what inhibits families from having these conversations is a fear of the difficult questions, and especially those regarding death. So, I don't want to open up the conversation because what if my child asks me, something hard and I don't know how to answer it? Or, I break down and cry when they do and I don't want my child to see me cry, or whatever it is. And families have, everybody has different kind of fears about, or kind of questions that would fall into that category. But what it often doesn't get taken into account is the negative and unintended consequences of not talking and the avoidance of the topic. So the kid is most likely, as in the example that I gave, they're gonna find out. At some point, they're going to know what is going on or what went on. And potentially that is going to really rupture the trust that existed between parent and child. It also can increase a child's anxiety to know that something is up, because kids are incredibly perceptive, and as good as parents may think they are at hiding stuff from them, they're just not that great. So kids know that something's up, and if the conversations aren't being had, it's sending the kids the message that we can't talk about this. This is too much. Perhaps you can't handle it. It's too big. It's too scary. And subsequently, kid, you're kind of on your own with this thing is up, but we can't all talk about. And that is not in a child's best interest in terms of the relationship, but also just in terms of their own functioning and resilience and anxiety, and putting them at risk for all kinds of other, sort of maladaptive behaviors. There's also a fair bit of research that suggests that kids and teens want to know about their parents' illness. And we'll get into a little bit, what level of information might be appropriate at different age, and different ages and developmental stages, but they want to be kept in the loop. That doesn't mean they need to be told every nitty-gritty thing, because it could be frightening, but they want to be kept apprised of what's going on. Okay. Oops. All right. So the consultations that we do with parents, typically we try to do them in person. That's not always possible, and so we're happy to do them over the phone. And they really start by discussing sort of the answers to 5 key questions, which is, what have you told your child? Sometimes it's nothing. And then we kind of have a conversation about what is getting, feels like it's getting in the way. And what are the actual words that have been used? So there's certainly families who sort of do some kind of mental gymnastics to explain what the parent's illness is without ever, and very explicitly don't use the word cancer, or, kind of hedge and describe it one way that yeah, maybe kind of is what's going on, but isn't overtly truthful. And again, that comes back to the same problem we talked about before, which is the possibility of breaking trust. That if at no point do we want to create a situation where we've lied to a child, or not quite been 100% truthful, and then have to go back and say, you remember that thing I told you before? Well, actually, it wasn't that, it was this. Because how can they move forward trusting that what you tell them is going to be accurate information? Now, again, that doesn't mean you need to tell them everything, but we really advocate for, talking to them and providing information that's, developmentally appropriate for their age. Okay, so what words have you, what have you told your child? How has your child faced other transitions or sort of other big stuff in their lives? Some kids sail through, not a big deal. Other kids have a really hard time with any kind of change to their routine. So understanding how kids have navigated these kinds of situations in the past can also help to inform what they're going to need to sort of successfully navigate what's happening in the family at this point. Specific worries, maybe this is a specific conversation, maybe it's something more general, but what is the parent, what are each of the parents' concerns if they're two parents, and how can we hopefully address those? And then whether or not they're helpful or unhelpful lessons learned so far. So everyone makes missteps, so maybe they tried to have some conversation or say something and the didn't go the way they expected, and sort of helping to process that, and then kind of what can we take from that in terms of then guiding next steps. And then we said the conversations they're afraid of having. So for example, I saw a family recently where the sort of primary concern on the, I think parents, but certainly the mother's part, had to do with whether or not to discuss the possibility of recurrence with her 4 and 7-year-old. The kids, knew all about her diagnosis and treatment, at an age-appropriate level, but they hadn't talked about the possibility that it could come back. And essentially, in that case, the kids are so young, and this was a woman who her disease had been detected extremely early. She had done extremely well through treatment, and her risk of recurrence was like in the 2% range. So we were able to have a conversation about it. It was more that it was her anxiety that it would recur and how would she talk to them if it did, than it was her feeling like they needed to know that that was a possibility. Because as we talked about it, at 4 and 7, their concept of time is limited at best. And so why kind of introduce this possibility when the chances in her particular case were so remote? And instead, let's just be very mindful of the language that we use such that we're never promising that, it's never going to come back, because, if on the off chance that it did, we'd have to backtrack. But we can talk about it in terms of, mommy's doing really well right now. The doctors are really, confident that she's going to be healthy for a long time, and sort of frame it in a way that is both accurate and also not going to unnecessarily introduce a source of worry for the kids. Oh, I don't know why that's getting cut off. Okay. So, yeah, I think it's, I don't know. Well, it says 3, well, you have it on your, is it printed properly? Okay, then I'm not gonna worry about it. So these are sort of 3 key areas to support childhood coping. And this is true regardless of what the stressor that the child is facing might be. So normal routine, emphasizing predictability and during times of uncertainty is critical, and particularly for young kids, as we'll talk about. So when certain aspects of life are uncertain and unpredictable, as is inherent in cancer treatment, how can we, despite the disruption it inherently causes, maintain as much as possible of the child's normal routine? So, continue with play dates, continue with soccer practice, whatever we need to do realistically to maintain kind of the normalcy of their lives is really important for their own sort of adjustment and coping. In some cases, this may mean even sort of increasing the routine and the predictability, having more consistent bedtimes, a more predictable bedtime routine. Again, that probably applies to younger kids. But, one thing that often happens is what we call sort of errors of kindness. Parents or other well-meaning, caregivers or friends being increasingly permissive during times of stress for the kids, which is coming from a good place, but the last thing kids need when things are uncertain is for the rules to go out the window and for things to be a lot more loosey-goosey than they're accustomed to. They really need that predictability and consistency that hopefully was in place before that can continue or even sort of increased. Protecting family time and routine. Obviously, we talked about routine, but there's so many other demands on a family system when treatment is introduced that finding ways to prioritize, kind of whatever family time looked like before, it's going to look different now, but protecting that however we can. And that may mean sort of recruiting other resources to sort of farm out some of the other things that need to happen in order to kind of save the potentially limited energy that a parent has for the kids and, their whatever, supporting their needs. And then facilitating communication. So another thing to sort of be cautious about, and this, I guess, sort of comes back to the protecting family routine, is to be wary about or mindful, I should say, of how much sort of outsiders or visitors are involved. They can be involved, and we would strongly encourage them to be involved, sort of helping, but kids will pick up on a parent who, when they have visitors, sort of the parent is able to kind of rally for, the length of their visit and subsequently is totally exhausted and doesn't have anything left for the child. And a child can perceive this as, oh, well, they're all up, mom's all upbeat and seems to like that person better, but then when I ask to play, she's too tired. And that's not really what's going on, but that can be a really common way that a child experiences it. So how can we kind of balance the need to, seek support and interact with the outside world, but also, reserve the resources that the child needs from the parent to the extent possible. So thinking about, what others can do to kind of facilitate these three goals. Okay, so one idea is, that the program talks a lot about, is sort of appointing a captain of kindness. So this would sort of be like a point person between the family and those in the community who are eager to help and provide support and sort of manage the well-wishers. So what that ends up doing is it sort of gives the family one person that they're communicating with, and that person can then sort of run interference and manage the, support and, good intentions of everybody else, while again, limiting what the parent needs to do and preserving their time and energy for the family. And also can just sort of mitigate the overwhelming nature of offers to help, and sort of direct them in a way that's actually helpful to what that family needs at that point. Same idea with this minister of information, sort of identifying a point person who can serve as sort of the family spokesperson in a way, to, kind of communicate information. And the other piece about information is to be incredibly mindful, particularly in this day and age with social media, about who knows what and how that information is being managed. So if, in terms of what a child's gonna see. So if you're, talking to a good friend of yours and that friend then posts something to Facebook, does your teen have access to that information? And is that information you want them to have access to? So being very mindful about kind of how information is managed. The other piece is we always strongly recommend, and some parents are more open to this than others, but that the child's teachers and school and sort of other key players be notified of what's going on in the family. How much information they're provided, is going to vary based on the age of the child and all kinds of things. But they probably spend a significant amount of time with the child, and you're not asking them to do anything. You're just asking them to know what's going on in this child's world and, give you a heads up if anything seems amiss to them as sort of another set of eyes and ears. But no matter what information is being shared, especially as kids get older, letting them know that you're going to be telling the guidance counselor this, X, Y, and Z. So again, they don't think you're going behind their back. Now, they may say, well, I don't want you to, and you may have to say, well, tough. I think it's important that they know. But just to keep everybody kind of on the same page, the school age and younger probably isn't going to care what you tell their teacher, and you can, share as much or as little information as you feel comfortable. But just keeping the information intentional and being thoughtful about it. Okay. So in service of open communication, as we said, we never want to lie to the child, and we want to provide information that's developmentally appropriate. And then we can sort of build on that and fill in the layers as they get older and are better able to understand what's going on. So answering questions in an honest and appropriate way. And over-detailed is not the definition of honest communication. So kids don't necessarily need more information. They need information that's targeting kind of their level of understanding. Naming the cancer, calling it cancer, gives the family and sort of everyone involved a common language to talk about what's going on. To skirt around it, to tiptoe around it, while again, perhaps well-meaning, doesn't put everybody on the same footing of knowing what's going on. One of the things that often comes up is, adults, and in some families, kids as well, have associations with cancer. There's, a family member, a community member, a grandparent who perhaps has died of cancer. And so the parent is very concerned that the child will make that association and therefore and this and jump to a conclusion. And we'll talk a little bit about ways to sort of differentiate types of cancer for kids at different sort of age levels. But the other piece of this is the importance of modeling that good questions deserve good answers. So one of my favorite sort of, catchphrase or just have it in your back pocket is, that's a really good question. I'm going to have to think about it and get back to you. You may have an answer, but not be sure how you want to phrase it or how to kind of present it to, a 12-year-old or a 3-year-old or whatever it is. And as long as you, in fact, circle back and talk to that child, after you've had a chance to talk to the doctor or whomever, or just to take some time to think about it, there is no harm done. It's much better to take that time than to say something and then, either jeopardize future communication or not, be honest with the kids. You just have to follow through. So it might take a week and a half or 3 weeks, but as long as you, let the kid know, hey, I haven't forgotten about your question, but I'm working on getting an answer or whatever, that's very few kids are going to sort of have any strong reaction to that. And sort of having this in your back pocket, hopefully, and I think for a lot of the families I see, kind of gives them a tool to reduce their own anxiety about what a kid might ask, because no matter what the kid asks, they can say that. Like, whether they know the actual information or not, it can buy them some time to be more thoughtful about it. Okay. So in terms of differentiating cancer or describing cancer to kids of different ages, you sort of have to pick a metaphor that works best for the child. But a couple of my favorites, which I really can't take credit for, but is this idea that, like, of dog breeds. Most kids, even young kids, understand that, like, dogs look different. They're big ones, they're small ones, they're nice ones, they're curly ones, whatever. They're all dogs. And like that, there are lots of different kinds of cancers, but they're all cancers. And, that's sort of a concrete way to, make it a little more understandable for kids. And then from there, you've sort of set the stage for being able to say, the doctors know a whole lot about how to, treat certain kinds of cancers, but they're still learning about others, and sort of sets the stage that, yeah, sure, there's this umbrella term, but not all cancers are the same. So, what Grandpa died of at 96 is very, very different, even though they share a name from, what, their parent has or somebody else. For older kids, we can use sort of more of a Lego metaphor where, like, because they have a little better understanding of, like, cells, and that everything needs to fit together. And then there's a weird Lego in there that just doesn't fit with the rest. And there are more and more of these Legos that don't fit. And the medicine, or the surgery or whatever it is working to get rid of those Legos that don't fit. Again, you just have to sort of know your kid and what's going to connect, hopefully, with them. Okay. Sort of another piece of this is a lot of parents sort of build up in their minds that this is going to be like the talk, which puts a tremendous amount of pressure on them, and the idea that, like, it has to go, they have to do it right, which there is no such thing. But rather, this is just like you're opening up a topic of conversation, and you're going to have many ongoing conversations over the course of however long, probably forever, because this is now part of the family's history or story. But, it's going to evolve as treatment unfolds and as, things sort of go in new directions. And if we can kind of reduce the anxiety that it be this one and done that has to go perfectly, that can kind of help to facilitate the conversation. Thinking about the best times to talk, for some kids that might be like right before bed. For other kids, it might not be. Like, thinking about when your child is at their best, when there are other, support people around that can help, whether if you've got multiple kids at different ages, are you going to have the conversation with them together developmentally? Is the information you're going to be providing appropriate for both ages, or not? But sort of being thoughtful about that in advance can help facilitate a more productive conversation. And then, as we said, they don't have to be answered immediately. Any questions? Okay. So I'm going to go through this stuff a little more quickly. But so giving families some idea of what they can expect as sort of very normative reactions from their kids, that emotions, whether it be anxiety or, other strong emotions, often come in waves, and kids, like adults, are very capable of sort of just bobbing with the wave and going with it and knowing that it'll pass, or fighting it and getting knocked down. And that can sort of be a part of the conversation, is that, like, sometimes it's going to be a little harder and our feelings might be a little stronger, but you can tolerate that. You know, kid, this happens to mom and dad too. We can tolerate it. We can, you know, weather this together and sort of bob with the waves and know that it's gonna pass. Sort of talking to the kid about what the communication plan is, you know, providing a guess, or, you know, asking the child, you know, do you want us to tell you every time we have a doctor's appointment, or just when we have a, you know, a big one? I don't know. You know, sort of giving the child some control over how much information they feel they want and need, and then always leaving it with, you know, but you can always change your mind. So the kid has some control over kind of what they're hearing. And then sharing changes when they occur. So, or when, you know, finding some way to reassure the child if sort of the status quo is expected to go on for a while. A lot of times what ends up happening is I'll meet with a family, kind of send them on their way, and then we'll either decide to reconvene just prior to, you know, the next stage, you know, a surgery or a big scan, or some other sort of junction in treatment, or, you know, at some point down the road where there's sort of new information to kind of process and present to the kids. And by letting kids know not just that there's this big thing coming up, but like, oh, we had a regular checkup and everything's good, can also provide a tremendous amount of reassurance that the child then knows that, oh, like mom and dad are going to tell me when something's changing, and they're also going to provide reassurance that, oh, I don't need to worry, like everything's good for now. And that is really important. Okay. So I've referred to this a lot in terms of developmental stages. And in addition to sort of all the developmental tasks that go along with, you know, getting older, their understanding and capacity to process illness and its implications also varies by age. So we'll talk a little bit about in each of these age groups. Anybody with kids under 2.5? Okay. Preschoolers? 3 to 6? Okay. Elementary, 7 to 12? Okay. So we've got everything. And adolescents? Okay. Any young adults? Post 18? Functioning, living out on their own? Okay. We'll skip them. Okay. So for little ones, their kind of primary task is attachment, and it's nonverbal, and they're really not going to actually remember in any sense of the way an older child or adult would what's going on. But routine is incredibly important, and providing a narrative of the experience that they can perhaps then reflect on later can be really helpful. So sometimes parents like to create photo albums or videos, letters, journals, whatever, just so that like when the child is older, they can kind of look back and remember, or sort of have some understanding of what things were like during that time when, you know, mom was going through treatment. Maximizing consistency and routine in caregivers, particularly important for little ones and potentially challenging. So maybe this means, you know, creating a portable, familiar environment, like the pack and play with a familiar sheet, blanket, and music that goes with parents to the hospital when there's a late infusion or there's an overnight, so that there's some, you know, kind of routine and consistency that the child can come to expect or sort of have in their day-to-day.
And how long after treatment do you have to keep the consistency of the additional caregivers or additional support?
I mean, it really varies. I mean, I don't think there's a single cutoff. And I mean, kids can have multiple caregivers. It's best for them if they're familiar people and it's, not just a revolving door of new people. So, I mean, kids in general, consistency is good, sort of as they get older. But I don't think there's like a specific amount of time. And even though they may be very young and nonverbal themselves, still prompting them and letting them know that like, oh, grandma's gonna pick you up from daycare today, and then, I'll see you when you wake up in the morning, or whatever it is, just to help them kind of anticipate, to the extent that a, kid under 2.5 can really anticipate anything, but to sort of prompt them with what to expect. Oh, that is very strange. Okay. So preschoolers at this age, it's cut off, but they're super fun if you have them or had them. And they really seamlessly weave fantasy and reality together, which we call associative logic. They just mix things up, and yet egocentricity like reigns supreme. So it's all about them, and they are the center of their universe because that's how where they are developmentally. They're like not yet at the point, especially on the early end of this 3 to 6 range, where they're able to like take other people's perspectives. So when you put those two things together, they jump to the conclusion that they have a lot more control over what's going on than they actually do. Oops. So it's my fault. They're likely to feel responsible for whatever's going on. So, I didn't pick up my toys, and that's why, mommy got sick, because it's all about them. And now there's some connection between picking up toys and getting a diagnosis, because we're preschoolers, and that's the way we're interacting with and learning about the world. So one piece of that then, or sort of combating that, is to anticipate that and sort of overtly correct any false beliefs around that, and really emphasize that, there's nothing that they did or didn't do or thought or didn't think that has any bearing on what's going on for the parent. So maintaining routines, warm limit setting, expecting there to be a disconnect between what the kid says and what they're, feeling or how they're acting. And instead of interpreting that disconnect, just, kind of putting it out as like a question. It's sort of fuzzy there, but like, you really don't like peas for dinner, versus like, it's my melanoma, not the peas that's upsetting you. Like, maybe they really just don't like peas, but sort of giving an opportunity that like you're observing their behavior, and maybe it's connected, and maybe, but don't overinterpret it, kind of thing. So by elementary school, kids are increasingly sort of independent, relatively speaking. They're really focused on rules and fairness, and there's a rigidity to the way things are supposed to go. Language is much more at their disposal, and yet they're still very concrete. So we've moved beyond associative logic to cause and effect. So illnesses must be contagious, and cancer must be caused by cigarettes. Very concrete, very, one thing causes the other, no room for gray, and usually false. So giving simple explanations about what's going on and why, explain, again, in very concrete terms, what symptoms might be related to the medicine versus the disease. Some kids, may not be interested in that. school becomes a much more kind of central part of kids' lives at this point. So encouraging, teachers to sort of keep eyes and ears out for anything concerning, but you're not asking them to probe. You're just asking them to be another set of eyes and ears and, share anything that the child might have said that is, concerning to them. This is where protecting family time, limiting visitors, having cell phones off at meal times, or really kind of encouraging excuse me, conversations with other important adults in their lives can become more sort of central to kids. And also, with kids being at school more, give an opportunity to have those adult conversations really outside of time that would otherwise be spent with kids. Another just sort of idea around this is some families like to kind of set up a certain, time each week with the parent and the child to kind of go over, all the child's accomplishments that week. And then giving the parent, an opportunity to kind of attend to the details that, they may not have kind of had the capacity to do on an ongoing basis over the course of the week in a way that they might if they weren't, in the midst of treatment. Adolescence, always fun. Abstract thinking, definitely coming on board, but still probably going to be another, 7 years till it's fully developed. And a huge discrepancy very often between what they understand intellectually and how they act. So this is probably one of the most frustrating things for parents of teens to begin with is, well, they tell me they understand that like grades are important, but then they can't sit down to do anything about it. Totally normal, albeit infuriating. But that also holds true when it comes to understanding a parent's illness and its impact. So they might be able to understand that, let's say worst case scenario, time is limited, but that's not necessarily going to change the fact that they're asking for permission to go out with their friends and essentially be gone all weekend. So it's not that they're doing that intentionally. It just has to do with sort of the limitations of where they are developmentally at that point. Typically at this point, parents are not the ones that teens are turning to confide in. That's not a personal insult. That's developmentally normal. And important to encourage that they, identify other trusted adults with whom they can have conversations and talk to. Coaches, teachers, whomever, but to not sort of push you have to tell me how you're feeling, because that's just not going to facilitate a great outcome. What can become more apparent, although it often is evident much earlier, at much younger ages as well, is that kids have made very different relationships with either parent. And a lot of times, they'll say like, oh, well, their dad only needs to ask them once to comply with, taking out the garbage. And this can become sort of magnified when one parent is sick and the child is sort of trying to wrap their mind around and make sense of, well, what does that mean for my relationship with that parent? And there may be some avoidance, or it's just different now because, mom doesn't have as much energy or whatever. And so kind of, if we can set the expectation that those discrepancies may increase, and that to hopefully help parents not take it personally, can be very helpful. In terms of parenting tips for this age group, being very mindful not to assign teens overtly or inadvertently any kind of parenting or caregiving role to younger siblings. Girls can especially kind of pull for this, but being very mindful about what is sort of developmentally appropriate for the child, or for the teen, if parent weren't ill. Now, there are going to be circumstances where this isn't possible and the child needs to kind of step in and provide some kind of care or support, and that's fine. But sort of as a broad thing to be aware of, to really encourage, again, as much normalcy and consistency with whatever they were engaged in prior to the diagnosis, that continue as well. We won't really talk about it since nobody here has sort of young adults, but that always sort of comes up as a question, do they take a semester off of college and come back home to, help out? And, again, there may be situations where doing so isn't everybody's best interest, but by and large, supporting kids and continuing to live their lives and sort of march through their own developmental stages, whatever they may be, is really important. Supporting those relationships with important adults outside of their, the immediate family, respecting teens' coping strategies, which may look very different from, younger kids or the parents themselves. It may look very reclusive or who knows, but sort of keeping that in mind, and also being attuned to signs of sort of more problematic symptoms, whether it's depression or risk-taking behaviors, substance use, changes in academic performance, and other kind of indicators that the child may be struggling in some way. Okay, we'll skip this. Okay, although this statement at the bottom, I think, applies to maybe not the preschool and school-age kids, but, for teens and older than that, this idea that, it's okay to continue to enjoy and live your life and pursue the things that are important to you, even though, mom or dad is sick, and that those two things can co-occur and are important to do. All right, so there are kind of two ways to think about a parental cancer diagnosis, either as a challenge versus a trauma. So a challenge would be kind of the combination of adversity plus the support and connection to navigate it effectively. So build resilience, greater self-confidence, the idea that okay, hard stuff happens, and when it does, I have the tools or know sort of how to navigate that effectively. Versus adversity by itself often leads to a sense of isolation, helplessness. I don't know what's going to hit me, and when it does, I don't know what to do, or I don't know what I'm going to do, and so kids have all kinds of reactions at that point, but it doesn't give an opportunity to sort of learn and grow from a difficult experience. So parental illness can be either of these, depending on sort of how it's managed and how the child is sort of supported and involved in the process. A couple of resources. The top one, obviously, is the website for the program in Boston, which has all kinds of great resources. Doesn't apply so much for this with you guys, but there's Staying Strong has sort of a military focus in terms of the families they're working with, but the principles are very much consistent. A few other resources. This book, I have a copy of, some of you guys may have seen it. This is the book that was sort of born out of the development of this program and their years of experience. It doesn't apply just to cancer, but it's sort of a nice handbook that goes through in obviously greater detail a lot of the sort of developmental perspective and issues to keep in mind around communication with kids and coping. This is for providers, so we can skip that. Questions? That's it. Yeah, my pleasure.
So in the young adult section, you talked about things to watch for. But in the younger ages, how do you know if the child is not, what parents are afraid of, that they won't take it may take the information hard, or maybe afraid or insecure, or feel like the parent may die or something, right?
So are you asking about a specific age group or just in general?
How do you know, for example, preschoolers, what are the risk factors for preschoolers and for infancy?
So for infancy and preschoolers, and largely for elementary and school age kids, although as they get older they have more language to be able to communicate, a kid's sleeping patterns, changes to their eating or their appetite, changes to their play in terms of they just don't want to play. You take them to the park now and they just don't want to do anything, but previously they were eager to do all kinds of things, and sort of increased behavioral meltdowns or crying or kind of anything that would probably hopefully raise a red flag for you, with a child that age anyway. I think in this context, to have a little bit, almost like a higher threshold, you may well see some of that, and that may not be an indication that there's anything wrong, but rather it's sort of a normative reaction. But you would expect or sort of hope things would sort of normalize back to kind of where they were after a period of time. But if it really persists, that could be a warning or a red flag. But really sort of observable behavioral changes with younger kids. Other questions? Yeah.
So one thing I have worried about a lot with my kids is I have a lot of wonderful friends and family, and so I get a lot of love and attention. I don't want them to think because I happen to be sick, that's why I'm getting it. I get it anyway, and I know that as an adult, but I don't know if they know that.
And I think you can explain that to them. I mean, you had teens?
I have,
Or
yes.
school-age teens?
Yes,
So,
school-age.
verbal kids.
Yes.
So, you can explain that to them. That one of the things you're concerned about is that they are, making some link that you're getting all this, support and attention because you're sick. But actually, they may not have been aware of it, but this has sort of been the way it's always been. And, you're very lucky to have, to sort of couch it in those terms, and even use it as an opportunity to check in with them. Do you feel like you're getting the, support and attention that you need with everything going on? They'll probably not answer you, but you can at least throw it out there. Maybe the younger one will, but the teens will roll their eyes and move on. You had a question?
Yeah, we have a 4-year-old and a 2-year-old.
Okay.
And I was just wondering, our 4-year-old doesn't ask very many questions, and I was afraid maybe she's already thought that, this is something we can't talk about. I think we have talked about it. She knows it's cancer, and, the teachers know and everything, but yeah, I'm just worried, she doesn't ask any questions. Is that normal?
Yeah. That's not unusual at all, and I think the most you can do is, you can talk to her about it. She doesn't have to say anything. You can tell her, oh, we have an appointment, and oh, Daddy, I don't know who's sick, but, Mommy or Daddy went to the doctor and, got some new medicine. And she doesn't have to say anything. It's possible that the information you're providing her is enough, that she just doesn't have questions. And so, all you can do at that point is really encourage that, and if you ever do have questions, you can ask us. And if we don't know the answer, we'll find out. And again, if she's not asking questions and you're not seeing any concerning changes to behavior, she's just sort of going along being her 4-year-old self, I don't think it's something you need to worry about. Other questions?
to know a lot about kids. Why does this program like not talk to kids or have like workshops with kids or give a community to kids?
For a number of reasons. It's just not designed to have that be the focus. There are other programs, albeit not really so much around here, that do offer support groups for kids. Not for kids as young as yours, but for older kids. There's sort of ongoing debate about the pros and cons. A lot of times parents are far more interested in those kinds of groups for their kids than the kids are actually interested in the groups themselves, which makes it challenging to actually have people show up to. But it just has to do with kind of what the focus of this program is, and part of it being sort of how effective addressing parental concerns can be in terms of positive outcomes on the kids. There's certainly kids who benefit, in the course of a parent undergoing treatment, of having, a therapist or a counselor that they see individually, but that's not sort of a foregone conclusion that that's necessary. It just really depends on the individual child.
My child is young, but it feels like if I had an older child and you're already going through so much with the diagnosis and everything comes really fast at the parent, and the parent is trying to learn and cope and create a community and like build all the like support you need to go through it, and thinking about the child and like building these skills that you need to get this program right, just feels like a lot to ask, like parents who are already like under stress, with kids. Right?
Yes, absolutely. I mean, it's a tremendous amount. I mean, parenting under the most ideal conditions is, no easy task. But, I think there's also a sense that like parents are really at the front lines with their kids, and the ones who are going to be most effective at kind of knowing their child and tailoring the conversation to what the individual child needs. And, that's where sort of recruiting other resources sort of within the community comes in to hopefully offload some of those other responsibilities so that the parent does have, the time, energy, bandwidth, whatever, to continue to parent effectively. Other questions? Yeah.
So I'm gonna ask you, I'm just here as a friend.
Oh, cool.
So you were saying with the older kids, you wanna stay away from asking them to take care of the younger siblings? But like our oldest kids are getting close to driving age. Would you stay away from also like asking them to help take care of her? Like, I need a ride to the hospital or to a doctor's appointment. They need the hours anyway,
If they need no. Then that I would say is totally different.
But like, would you both? Like initially, they're gonna need the hours with
Right.
it anyway. But even after that, would you stay away from asking them to help with things like that as well, or?
I would stay away from having them help be an expectation. Kids, especially at that age, like most likely are being expected to help and contribute to the family in some variety, some way, no matter what. And just being mindful that, if sort of the expectation under normal circumstances would be that like, oh, and once you have your license, you're going to be, helping take little sister to dance practice. Well, then that's totally fine.
People without cancer do that, right?
Exactly.
Go to the store and get me some milk.
Totally. And, there may be occasions where because of the cancer, like somebody has to run to the pharmacy to pick something up and like, sorry, but like, it's got to be you, 16-year-old, here are the keys. Most 16-year-olds are going to be like super on board with that. But just making sure that one, it's not interfering with the things that they kind of normally should be doing. But it's still contributing to the family. And so I don't think there needs to be like a moratorium on helping by any means, but that it not become like an expectation and, you know, well, you can't go to soccer practice because you need to, you know, mom has an appointment that you have to drive her to, would kind of cross that threshold in my mind. So, other questions? All right. Thank you.